The ACL is the most important stabilizer of the knee joint. Thus, as an orthopedic surgeon specializing in knee injuries, we take ACL injuries very seriously. There are three main treatment options for ACL injuries. Number one is conservative treatment. Typically, this involves physical therapy and bracing and is reserved for older, less active patients. The second option is ACL repair with the bare implant. Historic methods of attempting to repair the injured ACL ligament have typically failed due to a lack of biological support. The ACL bare technique has been relatively revolutionary in providing a biological scaffold that allows the ACL injury to heal. The third option, and considered the gold standard or the most commonly used option, is ACL reconstruction. ACL reconstruction involves taking a graft and making a new ACL out of that graft. The most critical portion of an ACL reconstruction is making sure that the surgeon puts the ACL graft back where it belongs. In other words, putting the ACL back where you're born with it. So in the operating room, I'll use a tiny ruler to measure down to the millimeter of where your ACL should belong. We'll drill the appropriate tunnels and place the graft in an anatomic position. This will ensure an optimal recovery and an optimal post-operative rehabilitation course.